Just a few more minutes here. We'll wait and see if any last minute people hop on and we'll get started here on time at 12 p.m. So thanks for joining me today. Hang tight. We will start very soon. Well, let's get started, shall we? Thank you all who are joining us today live for our webinar that we're hosting called Power Through Perimenopause. So today we're going to be tackling everything perimenopause. And at the end, we'll have some time to answer any questions that you might have. So there is a chat feature on Zoom as well as a Q&A feature. So if any questions pop up throughout the presentation, feel free to drop them in there and we'll have some time here at the end to answer any of the questions that you have, which is definitely one of the benefits of attending live. So powering through perimenopause. Today, we're going to be talking about how we can thrive and not just survive throughout our 40s. So we're going to talk about how we can get you energy, improve your mood, and get you feeling that glow back that we had when we were in our 20s and 30s. So a little bit about me. So my name's Emily Koska. I'm a nurse practitioner here at Valley Vital Medicine. I joined the practice about 6 months ago, and I focus primarily on women's health and hormones. So that is my bread and butter and what I spend the majority of my time seeing and treating. So I do a lot with thyroid health, gut concerns, PCOS, perimenopause, menopause, and any just general hormone imbalances that my clients have concerns about. So I have experience in urgent care and doing Medicare health assessments, and something that I repeatedly was seeing and noticing was a lot of chronic disease and a lot of women who were on very similar medications in perimenopause and menopause. So many of them were on antidepressants and sleep medications. They were telling me that they were struggling with weight gain and brain fog and fatigue. And I quickly started to realize that there was something happening here. And what I realized was that it was hormones. So I've really done a deep dive into hormones, and I've been doing extensive training in hormone optimization and helping women feel better in perimenopause and menopause. So outside of work, I love spending time with my families, being outside when it's warm, and I also enjoy doing portrait photography. I've photographed over 300 weddings over the last 10 plus years. I also am a self-proclaimed Harry Potter nerd. I love coffee, and I'm a really big fan of a good burrito bowl. So that's just a little bit of fun stuff about me. So let's jump in. We always start with a disclaimer. Just to remind you that the information that we're providing today is for educational purposes only. So we're not providing any specific medical, psychological, or nutrition therapy advice as part of this presentation. You shouldn't use this information to self-diagnose or treat any of your health problems or illnesses without consulting your own medical practitioner. So always make sure that you're reaching out to them for specific guidance on your specific health situation. So today you are in the right place if you are feeling tired of feeling off balance, you're looking for more natural solutions that isn't just medications to slap that band-aid on the issues that you're noticing in perimenopause. If you believe that we can age gracefully and it can be an empowering experience and not just a matter of, well, you're getting older, you're going to gain weight and feel like crap. And if you're looking for, expert guidance in this area, I know in today's day and age with social media, it's really hard to discern information, especially when it comes to hormone replacement therapy, who you can trust and what information is accurate. And we're going to get into all of that today so that you can feel confident moving forward. So what we're going to talk about is perimenopause, how it impacts your body, the common signs and symptoms that go way beyond just the hot flashes that most of us associate with perimenopause, different lifestyle modifications that you can implement to really support hormone balance, some of the key supplements that you can take to help you kind of ease through that transition in your 40s. And then also, we will definitely be talking about hormone replacement therapy, bioidentical hormone replacement therapy. So make sure that you watch until the end so you can receive your special offer. So stick with us. There'll be lots of good information and some time for a Q&A at the end as well. So what is perimenopause? So perimenopause is that time, those years leading into menopause. Menopause, the average age is 51. So a lot of women will start to experience signs and symptoms of perimenopause 7 to 10 years before they go through menopause. And menopause is defined as 12 full months without a menstrual cycle. The day after that 12-month, you're considered postmenopausal. So perimenopause for some women can begin as early as your mid-30s, but certainly throughout your 40s as well. And what happens in perimenopause is our bodies begin to lose a really important hormone called inhibin. Inhibin plays a role in the levels of our estradiol. And so in perimenopause, when we lose that inhibin, we begin to develop erratic fluctuations in our estradiol levels, where one day we can be really high and the next day we can be really low in estradiol. And when that happens, we start to experience some of those pesky symptoms that a lot of women have during perimenopause. We also see the ovaries start to decline in production of testosterone and progesterone. So I always enjoy a really fun quote, and this is one that I really loved from someone that I consider a mentor, even though she doesn't know she's my mentor, but Dr. Mary Claire Haver, you may have heard of her. She's really big in the menopause space, has a lot of good information out there, but she had this quote and I loved it. We are often taught to dismiss symptoms as just part of getting older, but these symptoms are your body's way of speaking to you. Don't ignore them. So I hear this a lot with my clients. They are starting to notice changes in their 40s. They're feeling tired, drained. They're gaining weight despite not making any changes in their diet and their exercise. They're experiencing things like new anxiety, depression, brain fog. They're not sleeping well at night. And many times they're getting dismissed by their primary care provider, or they're only being offered things like pharmaceuticals. And I know as women that can be incredibly frustrating to feel like you're not being heard. But today, if anything you take away from this presentation, I just want you to be encouraged that you should trust your intuition, trust your body and what it's telling you, and know that there are practitioners out there who know how to help you during this transition. So stay encouraged that you can definitely feel better. So I've kind of mentioned a couple of the signs and symptoms that we can see during perimenopause, but here is a list of some of the more common ones that I see in my clients. However, this list is not exclusive. Like there are over 60 to 70 symptoms that can be associated with perimenopause and even postmenopause. So some of the more common ones that I see with my clients are things like hot flashes and night sweats. A big one is trouble sleeping. So a lot of my clients say they have a hard time falling asleep, staying asleep. They're waking up a lot throughout the night. Many of them experience new mood changes, so new anxiety, depression, irritability, worsening like PMS type symptoms that are new. Some will have genital urinary symptoms, so vaginal dryness, more pain with intercourse, maybe even things like bladder leakage, going to the bathroom more frequently, or even experiencing more urinary tract infections. Brain fog and troubles concentrating. Fatigue is a really big one. A lot of my clients complain about that big dip in energy. Some have heart palpitations, joint aches and pains, feeling really stiff in the morning when they're getting out of bed. Some are even noticing things like their hair starting to thin. They're noticing more fine lines and wrinkles. Some are developing new headaches and migraines. A lot of my clients start to notice changes in their weight, specifically around the midsection. So a lot of them have complaints about like new belly fat that they never had and a harder time dropping the weight as well. We can start to see changes on your blood work as well. So a lot of my clients, I start to see their cholesterol levels starting to go up, their triglycerides, and their HDL lowering. Some women, even as young as their 20s and 30s, we can start seeing signs of osteopenia. And another interesting one that I have had quite a few clients experiencing are things like dizzy spells, vertigo, things like that. So how do we approach perimenopause care here at Valley Vital Medicine? So we are a functional medicine practice, and we really focus on taking a functional approach to women in perimenopause, meaning getting down to the root cause. So a couple of the key areas that I focus on with my clients are gut health, our nutrition, our movement, stress reduction, optimizing our sleep. There's some key supplements that I recommend. Of course, the big one, which is bioidentical hormone replacement therapy, and then also our thyroid. So we're going to break these down and talk about each one. So gut health is really important. And honestly, I would say 90+% of my clients that come in to see me have some sort of gut issue. A lot of them are experiencing things like bloating, gas pains, constipation, or loose stools. And gut health is super important when we're talking about hormones because our gut helps us to metabolize estrogens. It helps us to absorb those critical nutrients that our body needs. It's really important in helping us to reduce our systemic inflammation, which is a big driver for chronic disease. It's important for our immune function, even our brain function. In our gut, it supports serotonin and GABA production. And then also it plays a role in stabilizing our blood sugars. So if the gut is not optimized and working how it should, that's kind of like the foundation of everything that we work on. So for a lot of my clients, we work on their gut health as part of optimizing their hormones and helping them transition through perimenopause. So if you are not having daily bowel movements, that is not normal. And I can tell you almost all of my clients have some form of gut issue. So working on that is going to be a key part of optimizing your hormones. Next is our nutrition. So there's some key components to our diet that we want to focus on when we're thinking about perimenopause, and those are going to be focusing on getting adequate protein intake. So almost all of my clients that I see are really, really low on protein intake. Protein is going to be really important when we talk about our ability to build and maintain our muscle mass, which protects our bones and prevents frailty as we age. It's also really important for stabilizing our blood sugars. And protein is really good for satiety, making us feel fuller for longer so that we don't have those sugar cravings and we're not overeating. So ideally, what I like to see my clients doing is eating about 1 gram of protein per pound of your ideal body weight. So if your goal weight is, or where you feel best is, let's say, for example, 160 pounds, then ideally, if we can get you close to that 160 grams a day, that is what is going to help when we talk about that ability to maintain your muscle, protect your bones, rev up your metabolism, and help prevent insulin resistance as we age. Another big part of our diet is going to be focusing on whole foods and trying to eliminate some of those processed foods and sugars. So anything that comes in a package, a box, a bag, trying to avoid those things and focus more on whole foods that are typically in the perimeter of the grocery store. So lots of fresh vegetables, fruits, and your meats is going to be kind of the staple in your diet that we see best results. Another big important part of our diet is going to be fiber intake. So fiber is not only important for our gut health and our gut microbiome, but it's also important to our estrogen metabolism as well. And if you recall earlier, we talked about how our estrogen is super erratic in perimenopause and all over the place. So making sure we're metabolizing our estrogen is going to be really important through dietary fiber intake. So I always tell my clients to aim for at least 25 grams per day, and I can guarantee most of us are maybe getting half of that. A lot of us are definitely under eating the fiber. Ideally, I like to see my clients getting their fiber from their foods. So aim for food sources first. If it's really hard to get enough in your food, then supplementing is an okay option as well. But you always want to be really mindful when and anytime you start increasing fiber to go slow with increasing the amount, because if you go too quick, you might experience more bloating and gas pains, and that's not what we want. So go really slow with that. Next is movement. Movement is super important. So I really heavily focus on resistance training for my clients at a minimum 3 times a week. Even a 30-minute resistance training program is wonderful. So lifting weights is going to be super important for helping you build your muscle mass. It's going to, over time, help you maintain and improve your bone density, which again, we start to see a decline in people's 20s and 30s. It's going to help with our metabolism. It will help with insulin resistance, preventing chronic disease, and it's also really good for our mental health as well. So I always tell my clients, again, focus on 3 weight training sessions a week. And you want to make sure that you're also lifting heavy. What does that mean? If you're going to do, let's say, 10 bicep curls, by the 7th, 8th, 9th rep, that weight should feel really heavy and challenging to you. If you feel like you get to 10 reps and you could go up to 20, the weight is too light. So a lot of these like yoga weights where it's like 2, 3 pounds, that's too little. You really have to challenge the muscles to help them grow. So if you're new to weight training, a great option is to work with a personal trainer to teach you technique and form to make sure that you don't have any injuries. We definitely don't want that. But even working with them for a couple of sessions to build a foundation is a great place to start. Another thing that I recommend is a lot of my clients love and enjoy walking, especially as it starts to warm up. They have dogs that need to get out and walk several times a day. An easy thing to add into that would be wearing a weighted vest. So there are studies that show that wearing weighted vests can help protect your bone over time. So I recommend starting with like 5 to 10% of your body weight. You can find these on Amazon. A lot of my clients will start with like a 7 or 8 pound vest and kind of go up from there as tolerated. So the great benefits of that, again, are it's going to help you build that strong bone tissue, but also it helps with your cardiovascular health as well. So carrying around a little extra weight on your walks will definitely get your heart rate up a little bit more and work your cardiovascular system, which we definitely want to. Stress reduction is a big one. A lot of us women definitely struggle with stress, whether it's work, family, children, all of that. So reducing stress is going to be really important. So here are some key tips, things that we can try to implement to help reduce stress. I mean, just getting outside, fresh air, grounding. Once it's nicer, I know right now it's pretty cold, but being outside in nature is huge for stress reduction. There's tons of studies on it. Practicing mindfulness. There's tons of apps that you can download that help you go through like guided meditation and mindfulness. One that I really like that we use at home is called the Calm app. And we even use it with our kids at bedtime. So that's a good one to check out. Doing breath work, socializing. There's tons of studies on how social isolation actually increases our risk for chronic disease over time. So being around people, socializing is really important. Journaling is great. Therapy. setting healthy boundaries in your life, learning how to say no to things at times, and then personal care. So everyone's stress reduction looks different in their life. Mine has been setting healthy boundaries, doing my red light therapy at night, and making sure that I'm getting enough sleep. Speaking of sleep, sleep is super important, and so many of my clients are not sleeping enough. I can't tell you how many women are telling me they're sleeping like 5 hours a night, and I don't know how they're functioning because 5 hours is definitely not enough. Optimal amount of sleep per night that you should be getting is 7 to 9 hours. So most people are not sleeping enough. Here's some tips that you can implement that are easy at home. Tracking sleep can be really helpful. I have a lot of clients that wear things like the Aura Ring or the Apple Watch, things like that to track their sleep to see what their sleep scores are. Gives them really good data and information on the quality of their sleep so that they can implement those changes to improve those numbers. Being really consistent is important too. This is something that I myself struggle with sometimes. So going to bed and waking up at the same time is really important with our circadian rhythm. Setting the right environment, make sure it's cool, dark, and quiet. Limiting blue light before bedtime. So blue light definitely decreases our production of melatonin, which is important for us when we're talking about sleep and our circadian rhythm. So our phones now have settings on there where we can change off the blue light and emit more of like that amber red light can be helpful. Making sure you're not eating heavy meals and snacking right up until bedtime. Remember, we want to rest and digest. Limiting caffeine and alcohol too can be really beneficial to optimize sleep. And there's a few other things, supplements and hormones that will help with that as well, but those are some key things we should be implementing too. So what are some of the supplements that I often see my clients needing? A big one is omega-3 fatty acids. So omega-3s are going to be really important to gut, brain, cardiovascular health, our skin health. It's going to be really important for inflammation, which I see a lot in my clients on their blood work. So implementing a really high quality omega-3 fatty acid supplement is super important. We do testing here at Valley Vital Medicine on all of our clients when they establish care with us. And one of those tests is an omega-3. And I have not had a single person come back with an optimal level because we don't get enough in our diets, especially in the area where we live, because we don't have fresh fish available to us. So that's a really important one. Vitamin D, again, another one that we check on our lab work here when we are checking on our clients. And I have most of my clients come back really low or suboptimal in their vitamin D levels, even when they're taking supplements over the counter. So vitamin D is going to be really important when we talk about our brain health, our cardiovascular health, our bones. It plays a really important role in inflammation as well. So making sure that those levels are optimized is going to be really important, and taking a high quality vitamin. I always recommend taking the vitamin D3 with K2. The best way to know how much to take is by checking your levels. So getting your blood levels checked will give us really good data and information on what the recommendation would be as far as dosing and what your body needs. Another important one that I see a lot is vitamin B12. When I think of B12, I think of energy, I think of mood. So really important in those functions, especially if you're struggling with some of that as well. So taking a high quality B vitamin can be really helpful for that. Again, test and know what your numbers are if you need to supplement, but a lot of my clients definitely need supplementation. Creatine is an important one. There's tons of studies on the benefits of creatine when it comes to recovery after workouts, your ability to build muscle. So that's a key one that I recommend to a lot of my clients in addition to the resistance training. Bioidentical hormone replacement therapy is a big part too, which we'll talk about here in a minute. There are some specific targeted supplements that we carry at our practice. One of them is the Rocasa hormone kit. So we carry the Rocasa line in our practice. If you haven't heard of it, it's a great company that offers non-toxic products from skincare, hair care, things you can give to your children when they're sick. The list goes on and on, but they also have an essential oil line. So the Rocasa hormone kit has been a big one that a lot of my clients have enjoyed using, myself included, to support their hormones. And if you do buy the kit in our practice, we do have a whole protocol that you can follow that outlines how to use all of the oils, which is super nice. Um, and then we also have a couple of key supplements, perimenopause support and menopause support, that have some herbals in it that are really supportive to helping you with some of those symptoms that you might be experiencing with perimenopause. So next is the fun part, which is bioidentical hormone replacement therapy. So what is it? Bioidentical hormone replacement therapy is a personalized approach that we can use when we manage your symptoms of perimenopause. When I think of hormone replacement therapy, I always think of it in two ways. One of the benefits of being on them is it's going to help manage the symptoms that women experience with perimenopause, but it also has protective benefits of being on them as well, as far as reducing risk for chronic disease as you age. And we'll talk a little bit more about that soon. So here at Valley Vital Medicine, we really advocate for using bioidentical hormones. What that means is the molecular structure of the hormones that we prescribe is identical to the hormones that your body has made your entire life, which is really important because the way that they act when they're bioidentical is the same as how your body has responded to the hormones your whole life. What we don't want to do is introduce the synthetic hormones, which have a different molecular structure and that behave differently in the body. So things like oral contraceptive pills or birth control have synthetic hormones that can increase your risk for things like cancers and blood clots. We do not prescribe any of those at our practice. 10, 15, 20 years ago, a lot of providers were prescribing things like Premarin and Provera, which are synthetic as well, and did show in some studies a slight increased risk. So we don't use any of those at our practice. We only use the bioidentical, which is typically sourced from plants from things like soy and yams. So a lot of you may have heard that hormones weren't safe. When you go and talk to your primary care provider that's in conventional medicine, a lot of them might tell you, well, hormones aren't safe, they cause cancer or they cause strokes or things like that. So I think it's really important to explain why they believe that and why it's untrue. So about 25 years ago, there was a big study that they did called the Women's Health Initiative. And in this trial, they were looking to uncover what the risk and benefits of hormone replacement therapy were. Now, when we look at this study that they did, it's really important to understand that this study was done with synthetic hormones. It was not done with bioidentical hormones. So there were several different groups in the study, and in one of the groups where they were receiving synthetic estrogen, which was sourced from pregnant horse urine, and synthetic progestins, they found a very slight increased risk of breast cancer in that group. And when they saw that, they quickly stopped the studies and the media grabbed hold of that and started telling everyone that hormones cause cancer. Now, that increased risk was 5 cases out of 1,000 instead of the normal 4 cases in 1,000. And again, this was with synthetic hormones, not bioidentical hormones. So I think it's really important to understand the difference. So they halted the study. But then they ended up continuing the study. And what they noticed was over time, there was actually a reduction in heart attacks, strokes, and cancers with the individuals who were even on the synthetic estrogen, which I think says a lot, even with a synthetic version. So a lot of conventional practitioners recall this study and still go based off of that misinformation. The people who did this study actually came back and retracted that information and came out to say that even synthetic hormones were safe, which I still would disagree with, but I think it's really important to discern the difference between the two. So what are the benefits of being on hormone replacement therapy? So like we talked about before, a lot of women will experience significant improvement in their symptoms of perimenopause. So their mood is better, their sleep is better, their energy has improved, they're able to lose the weight more easily, but there's also those protective benefits. So those protective benefits are our bone health. So it's been shown in studies to prevent the development of osteopenia and osteoporosis, and in some cases, even reverse those signs and build good, healthy bone. There's heart protective benefits, so it can help to lower our lipids. Um, we also see improved genital urinary symptoms, so less vaginal dryness, less bladder leakage, less urinary tract infections. It's great for mood, so stabilizing that, not noticing so much of the irritability, anxiety, depression. There are cognitive benefits. So in studies, there have been data showing that it actually decreases your risk for Alzheimer's and dementia as you age. And then the big one, which is just overall improvement in quality of life for women as we age. So let's talk about the two biggest hormones that I see deficiencies in perimenopause, and that's progesterone and testosterone. So progesterone in our reproductive years plays a role in our menstrual cycle and ovulation. It's also very uterine protective, and for women, it helps to sustain pregnancy. So when we have progesterone deficiency, we can see some of the mood changes, the sleep disturbances, are common ones that I see. Also things like hot flashes and night sweats. So by replacing the progesterone, it can help to improve sleep. It can help with the mood swings. We also commonly use progesterone in women with PCOS. We also get protection against breast cancer, uterine cancer. It also has cardiovascular benefit as well, so it's very protective of our heart and our blood vessels. And in studies, over time with the bioidentical progesterone, we see reduction in overall morbidity and mortality. How I like to prescribe progesterone is as a capsule that you take at bedtime. Now, the reason that we take it at bedtime is because it works on the GABA receptors in our brain, so it's very calming. It makes us sleepy. So the goal is by replacing it, it helps with the mood and the sleep piece. So I typically have my clients take it at bedtime. I do not generally use any topical forms of progesterone because the molecule is large and it's really hard to get enough absorption to boost your levels to notice the benefits. Some of my clients who have used the topical progesterones initially might notice a little bit of benefit from it, but long term, that typically goes away. And when we check their blood work, their levels are really, really low. So I typically like to do more of a oral compounded progesterone at bedtime. The other big hormone that we see a lot of deficiencies is testosterone. So a lot of us hear the word testosterone, we associate it with men. We think of like these big, like bulky weightlifters. That is not what testosterone is for women. So when I see women with testosterone deficiencies, they have brain fog, fatigue, anxiety, depression, they're gaining weight, they're losing their muscle mass, their sex drive is low, they have a lot of vaginal dryness. So when we replace that testosterone, it definitely helps. So it will improve your ability to build and maintain your muscle mass, which helps your metabolism over time and protects our bones. It will help to boost libido and improve sexual function. In studies, it has been shown to be protective for both heart and your blood vessels. It's been shown to be anti-proliferative to cancer cells. So there's actually studies showing that testosterone helps to kill cancer cells in breast cancer. So it's very breast protective as well. And for clients, we can also see a reduction in visceral fat, that fat that is around our organs that we can't necessarily see. And it also can help reduce visceral fat over time. So we can start to see those changes in 6 to 12 months of being on therapy. And again, testosterone is a big one that reduces overall morbidity and mortality in the studies. So actually, I'm going to jump back here. How I like to prescribe testosterone in women is via a cream. So The reason I like to use a cream is we get really good absorption. We're able to get levels to therapeutic levels where we need them to notice the benefits. And we have an easier time titrating the doses and avoiding any unwanted side effects and things like that. And I use a bioidentical cream, and I've seen really good results with my clients with that. There are other methods that you can use. There's pellets and there's injections, but creams typically tends to be my first go-to when someone is new on testosterone replacement therapy. So, what are the contraindications to hormone replacement therapy? Well, first off, the best thing that you can do is to have an informed conversation with a provider who has the appropriate training in hormone replacement therapy. Unfortunately, a lot of providers have not had this training. I went through nurse practitioner school and we didn't learn anything about hormones at all, unfortunately. And there are even studies showing that even your OBGYN does not receive menopause education in their schooling, which is really sad when we think about it. So finding the right provider who's had specialized training based on the medical literature and what the studies show are beneficial for people. So having that informed consent is really important. An absolute contraindication to some of the hormones would be any active form of breast cancer, especially hormone receptor positive type breast cancers. If you're breastfeeding, pregnant, trying to get pregnant, that would be a contraindication to some of the hormones, especially testosterone therapy, because we don't want to give babies testosterone. Okay. But those are the main ones. And again, having that informed conversation with your provider will really help you discern if you're a good candidate or not. But I will say more times than not, you are a candidate for hormone replacement therapy. Another one that's really important that I wanted to add in here and discuss is thyroid. So thyroid is super important when we talk about our metabolism. And I see this declining in a lot of my clients as we age, just as a normal physiologic part of aging. And I think it gets missed a lot. So understanding the thyroid is really important. Getting the appropriate testing is really important. So we do thorough testing here when we establish care with our clients. We look at 7 different biomarkers when we check thyroid. And how our thyroid works is we have our pituitary gland in our brain that sends signals to our thyroid gland that sits here in the front of the neck. It sends a signal to make thyroid hormone. And what it makes is a T4, which is an inactive or storage thyroid hormone. In conventional medicine, a lot of the times what they're looking at is just your TSH, which is that signal from the brain to your thyroid. And they see that it falls within the reference range and say, oh, it's normal, despite you having symptoms of suboptimal or hypothyroidism. And so once your body sends that signal to the thyroid, it makes inactive T4, and that T4 converts then into an active form of thyroid hormone, which is T3. T3 is really important because, again, it's the active form, and it's really the hormone that impacts how women feel in regards to thyroid function. So thyroid is a huge driver for our metabolism, and I like to think of it as the gasoline basically for every organ system in your body. So when your thyroid is suboptimal or hypothyroid, women will notice things like brain fog, fatigue, anxiety, depression, constipation, dry skin, brittle nails, thinning hair, weight gain, feeling cold all of the time. If you're having those symptoms, and your practitioner is telling you, well, your TSH is normal, so it's not your thyroid, I professionally disagree with that. Well, I like to look at your other numbers and see what is your T3 level at. And a lot of my clients have very suboptimal levels of T3. And by optimizing that T3 level, a lot of times we can significantly improve their symptoms. So I have clients that come to me with Hashimoto's or hypothyroidism, and they're on levothyroxine, and they don't feel any better. Well, levothyroxine, the medication they typically prescribe for Hashimoto's or hypothyroidism, only has T4 in it. So if your body does not convert T4 into T3, you will continue to feel the symptoms of having low thyroid despite having a normal TSH. So a lot of my clients, we will switch them off of the levothyroxine and put them on a desiccated thyroid that has both T3 and T4 in it, and they significantly improve. And it has been a huge game changer. Their energy improves, the brain fog improves, they're able to start losing weight again. They're not feeling cold all of the time. They have more energy. So, if you're struggling with any of those symptoms, I would definitely encourage you to look into your thyroid because that is something that I see a huge deficiency in with almost all of my clients. So, here at our practice, that is something that we definitely look into and that I treat quite a bit. Another fun quote: caring for your body, mind, and spirit is your greatest and grandest responsibility. It's about listening to the needs of your soul and then honoring them, which is what we're doing today. So, what are some of the like success stories or things that I'm hearing from my clients once we get them optimized on hormone and working on some of these lifestyle and key supplements? My clients say things like, I feel so much better. I'm sleeping. My mood has improved. I even lost 5 pounds. One of my clients, this one specifically, we switched from levothyroxine to a desiccated thyroid, and she was feeling better now than she's felt in 20 years. I have clients who especially start to notice menstrual cycle changes in perimenopause. So irregular, heavy, a lot of cramping. And a lot of those women are offered things like birth control, or they're offered a uterine ablation or a hysterectomy. Really, what those people need is progesterone. And so I have a lot of clients with menstrual cycle issues in perimenopause that we put onto progesterone, and they start to notice that their cycles are tolerable again. Their mood improves, and even their spouses are noticing, which I think is a huge win when spouses. And I've even had a couple of clients now that their husbands are wanting to start getting on hormones too. So you'll start to see that happen as well. So I know that's a lot of information that we just trekked through. So if you guys have any questions for me about perimenopause, hormones, supplements, our practice here at Valley Vital Medicine, feel free to drop them in the chat, or there is also a Q&A feature. Feel free to drop them in there, and I'm happy to help answer any questions that you might have today. I'll give you a minute here if you have any and see. But I really appreciate all of you hopping on with me today. I hope that there was some really good information here for you um, on things that you can start implementing and considering with your journey through perimenopause. So make sure that I'm not missing anything. Okay, don't see anything that's come through yet. So I'm gonna jump forward here. If you still have questions, feel free to drop them in there. So what do next steps look like? So maybe you were listening today and you're like, yep, 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 I have all of those symptoms. That's exactly how I'm feeling. And I'm not happy with the treatment options that I'm being provided. Your next step would be to book your discovery call. So how we establish care with our clients here at our practice is we first have you do a discovery call with me. This is a complimentary call where we'll go through and discuss what your goals are, what it is you're looking to achieve. I can share a little bit more about our approach here and how we get started, which is typically through our wellness experience. So our wellness experience includes full comprehensive lab panels, and then a 90-minute case review with me where we sit down and we go through everything together and kind of formulate a plan. But that would be your next step. And you can book that discovery call by going to our website there, valleyvitalmedicine.com/call. Okay, we have a question. Since bioidentical hormone therapy is from soy and yams, is it possible to eat these foods instead? Unfortunately, no, it does not have the same effect to eat those foods. So they do source from there, and basically what they do is they wash down the hormones from all of the proteins in it, and they're able to get to therapeutic levels that you would need to get absorption and notice the benefit. So if you were to like eat a ton of yams, that's not going to be enough to get your levels to the levels that we need to notice benefits. So a lot of these like topical creams that you can get over the counter or online, They will source from soy and yams as well, but it's so low and the absorption is so poor that we're not able to get your levels high enough to notice the benefits. So hopefully that helps answer your question. If not, let me know, but thank you for your question. Oh, I just noticed that we have the wrong date listed here on the slide. I apologize. So at the beginning of the presentation, we had talked about how we will have a special offer at the end, which we do. So if you book your discovery call before midnight tomorrow, which that should say 3/21/25, my apologies that it says 2/21, but 3/21/25. If you book your discovery call with me before midnight, we are offering $25 off of your wellness experience. So when you go to our website and you request to do a discovery call with me, there is an area where you can type in notes. So you can put any comments in there on, symptoms you're noticing or what you're interested in and working on. But you can also put in there that you attended the webinar, and we'll be able to see that and get you that $25 off your wellness experience, which again includes the full comprehensive lab panel, as well as the 90-minute case review with me. So this last slide here is just how you can stay connected with us here at Valley Vital Medicine. So we are on Instagram and Facebook. We're constantly putting out tons of information there about the different therapies and services that we offer at our practice. You can find me on Instagram as well, Emily Koska NP. I put out tons of information on hormones there as well. And then, of course, you can visit us on our website or give us a call if you have any additional questions. Happy to help answer if it's appropriate. Of course, we can't give out medical advice. Excuse me. But we'd be happy to guide you if we can. Otherwise, I'm so thankful that you guys joined me today. I hope you were able to take away some nuggets from this presentation. And yeah, I hope to see you on my schedule really soon for a discovery call. But it looks like I have one more question here. I used to take progesterone cream for my irregular cycle and it was really weird. I guess it wasn't enough to experience the full effect. Yes, absolutely. And that's what I hear a lot from my clients coming in who were previously on a progesterone cream and stopped because they didn't notice any changes. So a lot of those people, if appropriate, I will switch over to the capsule form that's compounded. Another thing that I'm seeing quite a bit is I have clients coming into me on the commercially available form of bioidentical progesterone, and I haven't had good results with the commercial form either. A lot of them are not noticing the benefit and they still have really low levels on their blood work, even taking the commercial form. So generally speaking, a lot of my clients are on a compounded version that is better quality, better absorption than the commercially available form as well. So hopefully that helps, but thank you for your comments. So awesome. Well, thank you all so much for your time today. I really appreciate it. I hope you have a great rest of your week. And if you need anything, just reach out. Have a great day.